According to state data, opioid-related deaths have increased in South Dakota since 2012. Last year, the Department of Social Services announced grants would be distributed to organizations working to fight opioid abuse. A local nonprofit is using that money to kick off a post-overdose response team for Lincoln and Minnehaha counties. In tonight's Eye on Keloland, Renee Ortiz shows us how it will make a difference.
45-year-old Nikki Shuffleman spent 29 years of her life drinking and using drugs.
I started using and drinking when I was like 14 years old. So just a continued use in different degree throughout my life. But until just over 3 years ago, there was always like some sort of use.
3 years ago, she decided to get help at Keystone Rehabilitation.
Really was that my life had just completely unraveled, and I know that there was more, so much more to live for.
Now, she wants to use her story as a way to help others as a peer support specialist with Emily's Hope.
Recovery is like a one-seat boat, so it's not about getting people into my boat, but guiding them to theirs and helping them find their own paths.
Shuffleman will work as part of Emily's Hope post-overdose response team.
Our PORT program, which post-overdose response team, is basically a follow-up program for people who have survived an overdose in Minnehaha and Lincoln counties.
When someone overdoses and survives that overdose, we are going to be able to reach them a number of ways. One of the ways will be if law enforcement is called. Law enforcement is going to give them our literature, our contact information. If they're transported by ambulance, the ambulance also has that, patient care EMS, and also the emergency rooms have all of our information and can release the patient's information to us with their permission.
PORT has been in the works for more than a year.
Our goal is really to try to respond when someone is at the ER, so within 2 hours of time, and connect them with a peer support specialist. When we meet with people initially, we are then going to follow up with them after a week, and then after that, it's twice a month for 6 months, and then for the last 6 months out of the year, it's once a month. So the goal is to really build a rapport with people so that we can really see them through this entire continuum.
To help save as many people as possible, Emily's Hope is collaborating with an array of organizations, medical teams, and law enforcement.
It's important to understand that law enforcement just plays one role in this, and that multiple people can collaborate together to work to make an impact. And I think Emily's Hope taking the steps to get this program rolling is an example of that.
According to the Sioux Falls Police Department, overdoses involving fentanyl have been rising in Sioux Falls since 2020. As the amount of fentanyl seized in the city increases, so does the number of overdoses. On average, between 15 to 30 people in Sioux Falls die every year from opioid use.
We respond to a variety of overdose calls, and each one is uniquely different. And a lot of times it requires medical intervention, and I think this is where the partnership with the hospital systems is key. We have an overdose response packet that we've left with people in the past, and to include their materials in that packet provides a source and a resource that families can go directly to, because many times they're looking for answers, or they're looking for help, or they're not sure where to start.
Shuffleman says she understands how hard recovery can be to navigate and wants to do her part to help those who need it most.
There is more support out there than you'll ever know, and it's beautiful, genuine support from great people who've gone through the exact same thing.
With Eye on Keloland, I'm Renee Ortiz.
Emily's Hope will also work alongside Straight Up Care, The Link, and the Center for Family Medicine to provide online and in-person resources and support.